This is one of the biggest challenges health systems have faced, especially during this pandemic. Healthcare facilities have become the top target for cybersecurity attacks. We need to understand how to protect the personal data of the patients, and privacy and security have to be our absolute priority. Having served in the European Governing Council and now in the HIMSS Board of Directors, it's essential to be engaged in this kind of committees, networks, because we can really learn a lot for what's happening in different contexts, in different industries.
You're listening to The Game-Changing Women of Healthcare, a podcast celebrating courage, perseverance, creativity, and vision in the pursuit of healthcare innovation. Join host Meg Escobosa in conversation with some of the most inspiring and forward-thinking women working in healthcare today. Meg goes behind the scenes to uncover previously untold stories of struggle and success in a notoriously complex and highly regulated industry. As the worlds of healthcare and technology continue to converge, and as women take on increasingly more important roles in both, these are timely tales that deserve to be told. And now, here's your host, Meg Escobosa.
Welcome back to the Game-Changing Women of Healthcare. I'm your host, Meg Escobosa. This month on the podcast, we're celebrating International Women's Day, which lands on March 8th, which means we're releasing 4 episodes this month. Today, we're very fortunate to be speaking with Elena Sini. She's Group CIO at GVM Care Research in Milan, Italy. Buonasera, Elena. I'm so happy to be speaking with you today.
Buonasera, Meg. It's a pleasure to be with you today.
You can see I'm sneaking in just the wee bit of Italian that I know. So I'm showing off for the listeners.
I love that. I really love that. Thank you so much.
We're very privileged to get this opportunity to talk with you. You're a sought after CIO in Europe, and you've got a lot of experience, and you're involved in a lot of organizations. What would be nice is to hear kind of your own journey to your current role. How did you get here? And, just in a summary, hit some of the highlights of your career. How did you get to your role today?
Thank you, Meg. It's really my pleasure, and thanks for having me here today. I'm a CIO. I have been, working as CIO for over 20 years now. And, most of these 20 years have been spent among Italian top-tier public and private healthcare providers. And I have a background in telecommunication engineering, so I started my career in a completely different industry. But since years 2000, I have been working as CIO in healthcare. I'm quite involved with HIMSS. I'm a member of the HIMSS Board of Directors and the HIMSS EMEA Advisory Board. And I also founded the HIMSS Italian Community. During my career, I have been involved in various committees, established by national and also regional healthcare bodies. I've been working with the ENISA, which is the European Union Agency for Cybersecurity, just providing advice, to drafting the European Union cyber guidelines for the healthcare sector. I also work as an adjunct professor since 2003. I have been invited to most relevant healthcare events in Europe. And so I'm happy I can rely on a quite international network of people. And I've learned a lot meeting brilliant minds in healthcare. So I'm a privileged person working in this interesting environment such as healthcare is, and especially these days.
Wow, yes. Oh my gosh. There's so many possibilities of where we could take the conversation. One thing that I wanted to inquire about, you may or may not be able to talk about it here, but we had to reschedule this call because you had a meeting with the head of your organization and the Italian health minister. And I'm just curious, is that something you can tell us about? Some big initiative that you guys are working on, or is there anything you can share?
What can I share with you? It's mostly related to what we do as HIMSS in Italy. So we are part of this healthcare environment in Italy, being a private provider or a public provider. So what we are doing right now, and this is something that I'm really committed to, it's overcoming the disparities which are significant that we face every day. I work for GVM. We said that it's a a pretty big Italian healthcare group that runs healthcare facilities at almost 28 in 10 Italian regions. So, what we face every day is, the struggle to integrate GVM's patient health data with the different information systems of the Italian regions. You have to understand that in Italy, there are many, electronic health records for each region. So, having operations in so many regions, but just being simply that you have to integrate your data. And this is happening in a context in Italy where, the market is also very fragmented with local suppliers that during last year have implemented the hospital information systems most of the time in a pretty customized way. So there's a strong need of, adoption of interoperability standards. So from this perspective, being GVM CIO and being also a member of the HIMSS Italian Community, we published a position paper on the inefficiencies of the regional electronic health records. And so this paper brought us to start a discussion with both the ministries of innovation and health. We are just hoping to give a meaningful contribution to the plan that Italy has drafted, because it's, now with the European Next Generation EU funds, every country have somehow defined a national plan for recovery and resilience. And so with this plan, Italy commits to make a significant step up in its virtual health capabilities. So as a community, as a private healthcare providers, we just want, to be able to support this plan, to really, make the difference, because, the digital challenges ahead of us are huge and the timing is crucial.
Mm-hmm. And so you are really in a position of influence. Are you able to collaborate with the other private providers in Italy to come up with the standards, or are you making a recommendation to the health minister and they're navigating with all the other organizations?
On this specific task, we've been collaborating with, also with the industry, with other research centers or other institutions, not specifically with other healthcare providers. Mm-hmm. But as I said, the HIMSS Italian Community is, it's quite, relevant right now. It's pretty committed and, active community in the country. So somehow this work was work that we carried on with specific, organizations, but at the same time, the result is all for the community to benefit. Mm-hmm. So I was also for 9 years, also the CIO of another relevant private healthcare provider, Humanitas. Somehow, I've had these experiences in two of the largest healthcare Italian private providers. And I also have a background from the public. We have been the CIO of a public institution for 10 years. So, I'm also a member of the community, having worked for so long in healthcare in Italy. So you have, a pretty wide network of people that can really help in trying to achieve in this kind of goals. So it's a collaborative approach, and I'm proud of that. The fact that no matter if you are from an industry partner, if you are from a healthcare provider, you are from a research center, from a university, there's a lot of collaboration with the Polytechnic University. Doesn't matter where you are from. What matters most is the fact that we are all committed, as I said before, to really, to really make an impact. This is the moment, and as I said, the timing is right. So if we can help, we love to.
Yeah. No, it's great. And I'm curious also, such an interesting trajectory from starting in telecom engineering and then shifting to health information technology. Can you just describe what caused you to make that shift?
Probably, as I said, the network, the people you happen to meet in your professional life. Actually, this is somehow, a funny story, how I got into healthcare, because as you said, I have a Master of Science in Telecommunication Engineering. So I started my career at RAI Research Center. RAI is the National Public Broadcasting Company. And once a former CEO of the RAI joined the Istituto Nazionale Tumori, which is the National Cancer Institute. This guy, his name is Gianni Locatelli, and I consider him a mentor to me. This person, when appointed to be the CEO of the National Cancer Institute, he was looking for a young engineer that might be up to taking on the role of a CIO. And so being the former CEO of the RAI, he reached out to RAI Research Center HR department and asked for, CVs of young engineers. He valued the experience in imaging and telecommunications and mostly valued the RAI Research Center's ability to train and shape professionals. So they had this great habit of keeping track of their own stuff, a sort of alumni, it's Italian, alumni of the RAI Research Center. So you have to consider that back then this was one of the leading research centers in Europe and globally, leading in defining standards in video technology such as MPEG. So I received this phone call. I was working actually with Canal Plus back then, which is a major French media and broadcasting company. I was in Helsinki, I remember so clearly. So I received this phone call from Locatelli's assistant, and she started just saying, hi, this is the National Cancer Institute. So I immediately started worrying that someone in my family might have got sick, I didn't get at first why they were calling me, and I still didn't understand since I hadn't applied for any open position. So yeah, I didn't even know they had my number. There was no LinkedIn back then. It was year 2000. So I was aware of whom Gianni Locatelli was. Anyways, I did an interview. I was fascinated by Locatelli's vision and passion. He was so committed to making a difference in patients' lives. So I took a leap and started working at the Istituto Nazionale Tumori for 10 years as CIO. So unfortunately, only 2 of those years along with Gianni Locatelli as CEO, but we've kept in touch. He's actually my father's age, and we still see each other from time to time, and I always give him a call when I'm back to consider a new job opportunity. And his advice has always been essential to me in all these past years.
Wow, that is amazing. And can you describe a little bit more about what he is like and what his influence has meant to you and what you've learned from him?
Mostly learned, how to be myself, in the role that I was taking as CIO. I was a young woman back then. And being a young woman somehow affected my career in a positive way, because, no one was really expecting me to succeed as CIO. I was, coming from a completely different industry with a very specific technical background, not a background in management. So when I became CIO, I replaced a 60-something man, former IBM executive, so the typical CIO. And this man, Locatelli, actually encouraged me to take this role. He had so many, trust. He believed I was up to it. And so he made me understand that, passion and commitment, they were important as well, skills acquired during so many years of experience. So I was young, but at the same time was passionate. I was, resilient and very, very committed. So he had so much trust in me. And, in this way, he really helped me achieve my goals, and even in the first couple of years that we worked together. And he was smart enough to hire also an advisor, a person who had so much experience. He is also one of my other mentors. Unfortunately, he recently died. And this person was able to, to shape me as a professional, at the same time to let me even, make my mistakes, and learn from them. So I had these 2 people, I was very young back then, and they really, trained me up. So I'm most grateful for the great experience I had with both of them. And the funny thing that we became friends, and we kept in touch for all these years, and we'll see each other from time to time. And we are still very close. As I said, one of them, which his name is Giuseppe Stacchiotoli, unfortunately, he died last year. But apart from that, I have been so lucky to have this kind of people, and, the possibility to work with them really shaped the professional I am today.
Did either one of them give you some unexpected advice? And like, to the uninitiated in the role of CIO, we wouldn't appreciate the importance of this advice? Or is there any advice that you just think was super inspiring and helpful to you?
I think the most relevant advice was just to be myself, to nurture my, let's say, enthusiasm, because I was that kind of person, The other most relevant advice, which would be pretty obvious, but at the beginning of my career, I really didn't have this kind of, understanding. It was, to really be able to build your own network and to rely on it. At the beginning, especially when you are, so focused in achieving a goal or, implementing, some project, whatever, you tend to be very focused on what you're doing on a daily basis. So you don't take enough time to just share experiences with others, to build your network, as I said. So this was also something that was very, very important for me at the beginning of my professional experience. You have to understand that, as I said, it was early years 2000. So it was, how much, 20 years ago. So even there weren't ways to connect with people. You have to physically go to an event, you have to interact in a very different kind of way. So the ability to have your own network was relevant. Challenge yourself constantly, try and change your perspectives, all these kind of things, which are very, relevant, because you have to somehow to gain confidence in yourself. And this, as a woman, it's not so easy to do,
Yeah. No, I know exactly. What are did you do anything to challenge yourself? What might you have tried that was a stretch for yourself?
I just consider the fact, that after 10 years at Cancer Institute, I decided to actually take the opportunity to go to work for the private organization. Working for the public could be a lifetime job. There are so many challenges working for a public institution, but at the same time, people really rarely tend to go somewhere else. So somehow I'm always looking, to gain more experience. I love to have more challenges, to put myself, in a more competitive scenario. So it's something that, I really value.
What would you say is an example where has your resilience ever been tested?
Yeah. Public institution in Italy could be a quite complex working environment because it's highly regulated. You're always struggling with lack of funding or adequate resources. And the CEOs are appointed by political parties. Now, it could be the Ministry of Health of the regional government. And this implies that the political instability that characterizes the Italian governments also affects directly the management of public institutions like hospitals and research centers. So you have to be flexible and resilient, in order to be able to navigate this ever-changing scenario. And often CEOs don't last long enough to make an impact. So when I was there, I happened to work with 6 different CEOs in 10 years. So this was, what was challenging, because every CEO, obviously they wanted to assess what you are doing, where we are headed, what is our IT strategy. So every time, you had to let them understand what you're doing and why. And, there are so many, obviously, also financial resources involved, and they always tend to be, okay, let's stop for now, and then we'll have to decide. So I think I was pretty resilient, because in all those years I changed so many CEOs, and I was always very, confirmed as a CIO to navigate, in a very complex scenario. And so I'm most grateful of the experience I had then. Yeah.
Well, it does sound like a challenging environment when you are shifting new CEOs every year, every other year. That's an incredible pace to keep up with the whims of the political times. You have a really special perspective because you have worked both in public and private and in research, and of course in a non-healthcare setting. Can you kind of share what you observe as the key differences, just for those of us who might be considering careers in healthcare that are either in the public sector or in the private sector? Can you just describe some of the key differences between those types of organizations from your experience in Italy?
I was lucky enough I have worked for a public institution, which is one of the leading public institutions in the country. So, it's the best example of a public institution. And so it's really rewarding from, personal point of view and also professional point of view. Public institution, for example, was a great experience. I had the opportunity to understand how to apply for fundings. It was really an interesting journey. And at the same time, that, as I said before, it's somehow too regulated context. There are so many, regulations you have to apply. And so sometimes it takes too much time to be able to implement, the project you're leading in a reasonable amount of time. Private institutions are more flexible. The way, decisions are made, it's easier, they are quicker, they are more active. And so somehow you are more able to make the difference in a private institution. So I have been lucky. I've worked with so many, inspiring people, skills. I'm so grateful all the years I spent in the public institution. But I have to say it's a little bit more challenging.
Mm-hmm. It seems like great opportunities have come to you, but you seem ready for them. Even if you don't feel ready, you're willing to take them on, to take that challenge. Can you describe a little bit more about what you're teaching? Where are you teaching? And what is that experience like?
I have to understand that I started working in IT in 2000, and back then in Italy, IT wasn't even considered a strategic, department within the organization. So I was lucky enough because Locatelli hired me in order to define this IT department, and I was, I directly reported to him that. At that time, usually IT was, just more or less people who take care of your PC and printers. There wasn't even a strategic function within the organization. So I started in 2003 with the University of Castellanza because I just wanted to make doctors, C-levels within hospitals aware of the strategic role of the information technologies in a healthcare organization. And then I have been working with the Politecnico University, with, the Cattolica University in Rome. So mostly for, masters and also with Humanitas, we had this course for doctors on the third year, which was called ICT for medicine. So the idea was to give students who were obviously in the path of becoming doctors all the tools necessary to understand the role of the IT in a hospital. So it was nice, and I actually have been doing this, for such a long time. And it's something that I really appreciate because it's not only opportunity to share what you are doing, but at the same time, have a lot of feedback and you share experiences. So it's really wonderful. So I had also the opportunity to follow many thesis projects. Many people had to, let's say, the final project work and they just wanted to do with me. So I somehow, kept all these contacts. And this is something that I really care about. It's something that I'm not simply sharing what I'm doing, what I think is relevant in healthcare nowadays, but also, having the direct feedback from people on the ground like myself, but actually work in different organizations. So it's pretty nice and interesting.
Yeah, there is definitely a theme in your life, keeping those relationships and maintaining and giving back. I'm hearing that.
Yeah.
I also am fascinated. The course that you teach, I imagine you couldn't just put it on autopilot and teach the same thing every year, given the 20 years we've just gone through in IT and healthcare. Yeah. So can you describe some of those changes that you've witnessed and had to kind of revamp your course around? Like, what are the most significant advancements in health IT over these 20 years that you've had to kind of adapt to and include in your course?
Yeah. This is funny because at the beginning, it was easier somehow. You were there just saying how IT is relevant, how can you rely on digital technologies, how digital technology can enable change, all this, it was somehow, and let's say top down. I don't know how to say. Anyway, it was, just sharing, all the possibilities now to understand the strategic role of the IT. The last few years, talking to these young students, I had to completely change the way I also interact with them because at the beginning, I was explaining why it's so relevant. And now these people, these young students just say to me, why digital technologies aren't mature enough in healthcare, because they come from their own experience as consumer,
Yeah.
So we say, okay, this is yeah. The question is to you, Professor, why? Explain me why healthcare, it's not lagging behind, let's say so. So in digital maturity, and they were right. So having to let them understand the complexity of the healthcare industry, which is not like any other industry.
Mm-hmm. What have you learned from teaching?
I learned to understand myself and my skills, better somehow, when you have to share with somebody what you've learned, what you believe is strategic, what are your insight on the job you're doing every day. I think it's also a way of learning, understanding a little bit more about yourself. And this helps. I think this is something I'm always focused on, We are evolving as a person, as a professional. And so, this is, I think, what I've learned most.
Yeah. Yeah. And, in the field of health IT, I know you're so involved in the cybersecurity issue. Maybe you could talk a little bit about that particular issue. Like, what do you see as the biggest threats to cybersecurity and health IT security, and how are the Europeans addressing it? Maybe you could share just from that perspective.
Threats to cybersecurity this is one of the biggest challenges health systems have faced, and especially during this pandemic, healthcare facilities have become, the top target for cybersecurity attacks. It's not easy because what we need to understand how to protect, the personal data of the patients, and privacy and security have to be at the top of your agenda, of our absolute priority. But at the same time, we haven't invested enough during the last few years. It wasn't so crucial for healthcare facilities. And so this is definitely one of the top priorities I think we have to face right now. And this is the reason why also as a professional, I was so interested in joining when ENISA asked this initiative, because as I said, we can share a lot in terms of experiences. We can learn a lot from what's happening in other industries. It's essential to be engaged in this kind of committees, networks, because we can really learn a lot for what's happening in different contexts, in different industries. And obviously, we have to protect the data related to the health of the people and the citizens. So it's a huge responsibility. And in the past, suffered also from a lack of funding. So I'm most grateful to the GDPR. I don't know if you're familiar with it. It's a European regulation of data privacy. I think because it's a really valuable tool. And so, raise the awareness and not only of people in healthcare, but also governments and institutions. So this is, I think, probably the biggest challenges to face right now. So I'm mostly interested in what's going to be next. And also, I think this is a topic that should be addressed, from, a national point of view. So far, many hospitals, everyone is, acting on their own. Recently in Italy, there has been established a new agency in order to address this kind of topic. So I'm really happy about it, because this is something that should be addressed from, a national point of view, not regional, not on the single hospital. So it's a real challenge.
Yeah. Well, on the GDPR, would you mind just giving a little brief explainer for anyone that may not be familiar with this regulation?
Yeah, it's a framework of regulation, has been, defined by the European Commission. It was about 2018, so it's in place. It's been 4 years now. What's more relevant about the GDPR, it doesn't say exactly how to do things, but gives you all the tools in order to understand the level of risk you're facing in your own organization, and the principle to adapt to. So it gives you a lot of flexibility. So the previous regulations were national regulations, and this is a European regulation, so it's not Italian, it's for all Europe. And so our previous regulation was most focused on something like, let's say, a to-do list. Now you have to do this, this, and that. Technology is such, is continuously evolving, so it's very difficult to be able to address all the technical issues that you may have at the moment. And the GDPR gives you more overall principles, and this principle can apply to any kind of situation. So it defines also another important thing, which is the accountability of the person who's in charge of a single organization. So a shift is the responsibility from the IT to the general manager, the CEO. So these people have to understand the level of risk they are facing in managing the data of the patients or the customers. And this gives more awareness to all the organization what actually the challenges they are facing in terms of cybersecurity. So I think it was really a great opportunity to act as Europeans, so not from every single country. And you can really work on a program in order to address all the challenges you face within your organization, relying on the principle of the GDPR.
Mm-hmm. If this is the biggest threat that's facing health IT, and it's just increasing over the last few years, where do you think the weakest link in the protection is right now? And what do you think can be done and should be done? Like, where's innovation happening to enable better cybersecurity?
Yeah, what I can obviously talk about Italy. What I see, that all these hospitals have these, the data centers. They are mostly on-premises data center. So Italian hospitals, during all the, let's say, 15, 20 years, just implemented electronic health records, EMRs, and they used to have all the servers and the data on-premises within their facilities. So inevitably, this is opens for some security threats, and so I think the challenge that we all face is actually how much the data is really secure within our systems, in our hospitals. Something that Italy is addressing with this National Plan for Recovery and Resilience is also, for example, to adopt a cloud infrastructure that could be available for public institutions to store their data in a safe, in a more secure way, with much more security. And so we have the technology. So this is always not a matter of technology. It's a matter, as I said, in having an overall governance of the security of health data within the country. So it's going to be a shift from on-premises solutions to cloud solutions. And it's not simple, this transition from on-premises and to the cloud. And that is something that we should look forward. At least this is my opinion.
Mm-hmm. And maybe you could describe a little bit about the workforce, the skill set that's needed for this new kind of future that we have, where data is stored in the cloud and the security is wrapped around it from there. What kind of skills do you think the next generation should really be good at this point?
You addressed a relevant topic. There's also lack of skills in terms of, security officers. So it's very rare, really rare to find, within the IT departments of Italian hospitals or healthcare groups, chief security officers. So this is a role that, it's very difficult to find people who actually act on this role. And so this is one of the most relevant problems I see right now.
And when you find people with security backgrounds, what field are they coming from? What industry?
Most of come from telco, there's a lot, they have banking, industry that somehow are more mature in terms of security. And they just, had to face this problem a few years ago, At the same time, healthcare is such a different context. So, you have to be able to attract the right people. At the same time, I think you should be able, if not hire the right person in order to be a CSO, but at the same time to be able to partner with the industry in order to let them support you with the best technology, the best skills, and, the competence you may need within your organization. This is a pretty challenging situation right now. It's a matter of lack of skills, and at the same time, every hospital has a different infrastructure, different information systems. And, in Italy, the market is very fragmented in terms of even the EMR solutions. And so every software, every system just poses different threats. So now I think that with the certification of EMR as a medical device, we are going into the right direction. But at the same time, it's still a long journey. It's something that I don't see happening so soon, unfortunately. We'll still need time.
What innovation or accomplishment in healthcare are you most proud of, if you can summarize all the millions of ways you've contributed?
Yeah, probably the thing I'm most proud of is the fact that I founded the HIMSS Italian Community. I've joined HIMSS in 2016, and having served in the European Governing Council and now in the HIMSS Board of Directors, the fact that in my country there wasn't, a chapter, a community, I thought it was such a missed opportunity. So all this, the chance and the opportunity to do so, to a brilliant and smart woman. She's Christina Rosen. She was vice president with HIMSS. Actually, she was leading all the European operations. And Christina helped me along the way. She was really essential in what we were able to achieve. So now we have a community which is pretty much active and engaged. So I'm very proud of our community and what we are doing. Already shared you some of the initiatives we are actually doing in Italy. Christina is for sure a great woman, and she, like any other great woman, she helped other women to create something. So this was also an opportunity for us to build a community. So it was, still is a nice journey, and so I'm proud of that.
Did you face any barriers to building this community? Was there anyone who resisted and thought we don't need a separate Italian HIMSS community?
The barriers we had to face at the beginning were, most related to the fact that people in Italy weren't familiar with HIMSS. So we had also to explain who HIMSS was, what was the value of building a community. And so at the beginning, people were saying, okay, but we are in Italy, we are a totally different market, we are using different, for example, vendors for the EMR. So how can we share experiences with professionals, with colleagues which work in different parts of in the US, they have different healthcare systems. So, people were most skeptical about the fact that this kind of collaboration could be useful for them. And the funny thing is that, just because we had to address these barriers at the very beginning, actually we understood the way we had to deliver the message, the way we had to present this community to the Italian colleagues. And right now, what we see on the contrary is the opposite problem. There are so many people who are asking us for advice, help, a place where we can share, find, a peer who is an expert on this and that. We are doing a lot of work on, for example, on cybersecurity and the regulation in order to understand and share what's next for us. So it's funny because you see that the initial barriers actually, helped us to address the message we were delivering. And now the community is really relevant, and many people are looking for, the community in order to help each other. We were able to understand the real value of the community during the pandemic because, Italy was the first country hit in Europe with the pandemic. And so we had the idea to launch these webinars that actually CIOs, but also CMOs, doctors, head of anesthesia, all the people who were really in the wards every day facing this challenge of the pandemic, they shared, best practices, what they've learned, how to address and how to, let's say, change your organization in order to be able to adapt to what's, the surge of patients that every day come to your hospital. And so these webinars, they were most useful. There was also a platform that we made available for clinical engineers, for example. So we had so many ICU department units were, set up in a matter of days. And so we were, the common space where people had these conversations going. And it was so nice because after that, as HIMSS, we did also a webinar with me and Nina Schneider, which is also a HIMSS board member. And it was somehow, Italy and Germany sharing experiences. And it turned out to be one of the most, viewed webinars HIMSS had. And this is exactly what I think the community is for. So this is what we are doing right now, trying to address what's most needed in our country, and at the same time open our discussions and collaboration also with other European and non-European countries. It's really interesting, and so I really love that.
Mm-hmm. What words of wisdom can you offer the next generation, who might be just in the earlier stages of their career considering a path either in health IT or healthcare in general? What would you say to them?
I'd just say, you have to nurture your passion, that this passion will drive you through all the hard times that you obviously are going to face during your professional experience. As I said, build your network and rely on it. Try and aim to work with the most inspiring and skilled people, and challenge yourself constantly. You have to push yourself, out of your comfort zone and, challenging yourself. It's so relevant. New project, new responsibilities. There are so many opportunities out there, and just grab it. So this is my advice.
When you think of innovation, what comes to mind? What do you think about?
Innovation, I think somehow, I don't know if you agree on this, but I have the feeling that innovation has become a bit of a buzzword,
Yeah.
And so I really don't know how to define innovation. So innovation to me, it truly applies when you address a real challenge, and the result is real added value to the patient. So I think this is the most important thing in healthcare. So if you are really able to innovate, if you really bring value to the patient.
Wonderful. And what do you think some of the most exciting innovations in healthcare are today?
The ones that may have the ability to understand health data in a profound and new ways.
Mm-hmm. And what are some of the most essential ingredients in healthcare innovation?
I'd say people with the right mindset and the right attitude.
Beautiful. Thank you. Thank you so much for taking the time with me and sharing your story with our audience.
Thank you, Meg. Thank you, really. Thank you for having me.
And thank you to our listeners for joining us today. If you enjoy our show, please consider leaving a rating and review wherever you listen. It helps us reach new listeners. And if you know other folks who might enjoy it, please spread the word. To find out more about the Krinsky Company, check out our website. See you next time.
Thank you for listening to the Game-Changing Women of Healthcare. This podcast was produced, engineered, edited, and scored by Calvin Marty. Please take a moment to subscribe via your favorite streaming service. The Game-Changing Women of Healthcare is a production of the Krinsky Company, a growth strategy and healthcare innovation consultancy. Visit us on the web at thekrinskyco.com.